I'm Kelly Warner. Before Congress convened for the holiday break, lawmakers agreed to inject nearly $3 billion into the Children's Health Insurance Program to keep it funded through March. CHIP insures kids whose families make too much to qualify for Medicaid, but not enough for private health insurance. The hope is that once Congress reconvenes in the new year, they will compromise on a way to fund CHIP long term. This program is critical for the health of about 120,000 children in Oregon who receive coverage. Pediatricians say making sure that all kids have access to preventative health care saves everyone money in the long run. When pediatrician Pilar Bradshaw started her practice, Eugene Pediatric Associates, she wanted to care for kids in the best way possible.
We think now 80 to 90% of medical unwellness is rooted in social or behavioral health unwellness.
So in 2014, her clinic did something innovative.
We've fully integrated behavioral health, social work, and medical care so that we're taking care of the whole child and the whole family, actually, in a way that we've never done before.
This medical home to 9,000 children embedded Thrive Behavioral Health, allowing medical providers and behavioral health specialists to work side by side.
I can see a kid for strep throat, but if I don't also fix the fact that the kid is living in a car and they and their parents are all terribly depressed, I'm just sort of rearranging the furniture on the, Titanic.
For Samantha Lease, whose two oldest daughters have autism, this integrated care model allows them to access the full spectrum of care they need under one roof.
And so they're just helping them to learn how to mostly socialize with their peers and work through their anxieties. Their therapist and their doctor talk to each other and communicate, and everybody knows what's going on.
Hello there.
Oregon Governor Kate Brown recently toured the clinic, publicly recognizing Eugene Pediatrics and Thrive Behavioral as the blueprint for children's health care, and says it's critical that all children have access to care regardless of family income.
For every $1 that you put into preventive services for kids, such as well baby checks, teenage checkups, immunizations, developmental screening, for every $1 you put in, you save $13 that you will have to spend if you don't do all that preventive work on fixing kids who are sick and broken and failing in school.
I just feel super blessed that we came here in the first place 7 years ago, and that as these issues unfolded with our girls, that we had those resources right here to help take care of them.
With its integrative care model, Eugene Pediatrics is rated as the highest quality pediatric clinic in our region by the Oregon Health Authority, far exceeding every measure of quality recognized by the state for pediatric care. For example, last year, the clinic screened 95% of its adolescent patients for depression and provided follow-up care to those who needed it. That far surpasses the state's screening goal of 25%. I'm Kelly Warner.